Dear, wait a second. What's that on your stomach?
Oh, those marks. I don't know. They just showed up a few weeks ago. I thought they were stretch marks.
Honey, are you okay? You've been tired a lot lately too.
I've been gaining weight, even though I haven't changed how I eat. My face feels puffy and my back hurts. I thought it was just stress.
Maybe it's more than stress. You should see a doctor.
Yeah, dear. Maybe you're right.
Don't worry, honey. Everything gonna be all right.
Good morning, Mrs. Jackson. The doctor is ready to see you. Please follow me.
Morning, Mrs. Jackson. I'm glad you could make it today. You mentioned you've been feeling unwell lately. Tell me what's been going on.
Doctor, I don't feel like myself anymore. I've been gaining weight, especially around my face and stomach. Even though I haven't changed my eating. My face looks rounder. My clothes don't fit. I bruise so easily. I'm tired all the time. Even climbing stairs feels difficult.
I understand, Mrs. Jackson. Let me ask you a few questions to get a clearer picture. I would like to ask about changes in your mood, weight, menstruation, and whether you are on any kind of medications. Have you noticed new stretch marks on your abdomen or thighs?
Yes. My periods have become irregular, and I've been more emotional than usual. And yes, I have these purple stretch marks on my abdomen. No steroid medications, I only take vitamins.
All right, Mrs. Jackson. I'd like to examine you now. Mrs. Jackson, you can relax now. Mrs. Jackson, based on your symptoms and what I found during the examination, I'm concerned that your body may be producing too much cortisol. Cortisol is a hormone made by the adrenal glands. This condition is called Cushing Syndrome.
Is it serious, doctor?
It can cause the changes you're experiencing. But the good news is, we can diagnose it accurately and treat it. The next step is to run a few specific tests to confirm what is happening.
Okay. I trust you. What tests do I need?
We'll start with an overnight dexamethasone suppression test, a 24-hour urine cortisol, and a blood test to check your ACTH level. We also need to do some radiological tests, such as a CT scan, an MRI, or sometimes both. These tests will help us understand what's causing your symptoms and guide us to the right treatment.
I really hope these tests will finally tell me what's going on, and that there's a way to treat it.
Welcome back, Mrs. Jackson. I've reviewed your test results. They give us clear answers.
I've been anxious to know, doctor. What did you find?
Your 24-hour urine cortisol was significantly elevated, and the overnight dexamethasone suppression test showed that your cortisol levels did not drop as expected. Your ACTH level is also high, which tells us the source is not the adrenal gland but the pituitary. The MRI of your pituitary gland shows a small adenoma, about 5 millimeters, producing excess ACTH. This confirms Cushing disease, the pituitary form of Cushing syndrome.
So it's a tumor. Is it dangerous?
It's benign, meaning not cancerous, but it causes hormonal imbalance. The good news is that it's treatable, and we've caught it early. Our first-line treatment will be cabergoline, a medication that helps reduce ACTH production from the pituitary. You'll take it twice weekly, and we'll monitor your cortisol levels closely.
Will I need surgery?
Not right away. Many patients respond well to cabergoline. We'll repeat your hormonal tests and MRI after a few months to see how the adenoma behaves. If the response isn't sufficient, we'll discuss other options, including surgery. But for now, medication is the best start.
Thank you, doctor. I feel better knowing there's a plan.
You're welcome, Mrs. Jackson. You've done the right thing by coming early. We'll work together step by step, and I'll be here to guide you through every stage.
Mrs. Jackson presented with progressive weight gain, fatigue, and classic Cushing features, such as moon face and purple striae. Her hormonal tests confirmed cortisol excess with elevated ACTH, and MRI imaging identified a small ACTH-secreting pituitary adenoma. These findings established the diagnosis of Cushing disease, and she began first-line treatment with cabergoline alongside scheduled follow-up testing. Cushing syndrome can arise from several different mechanisms. The most common cause is prolonged exposure to corticosteroid medications, known as iatrogenic Cushing syndrome. Endogenous causes include disorders that increase cortisol production inside the body. These may originate from the pituitary gland, where an ACTH-producing adenoma leads to Cushing disease. Other causes include ectopic ACTH secretion from tumors outside the pituitary, or autonomous cortisol production from adrenal adenomas or carcinomas. Patients often present with a combination of physical and metabolic changes. Common features include central obesity, moon face, and dorsocervical fat pad. The skin may show purple striae, easy bruising, and slow wound healing. Muscle weakness, especially in the proximal limbs, is frequently reported. Many patients experience hypertension, glucose intolerance, mood changes, and menstrual irregularities. Diagnosis begins with confirming cortisol excess. Screening tests include the overnight dexamethasone suppression test, 24-hour urinary free cortisol, and late-night salivary cortisol. Once hypercortisolism is established, ACTH levels help determine whether the cause is ACTH-dependent or ACTH-independent. For ACTH-dependent cases, further evaluation includes high-dose dexamethasone suppression testing and pituitary MRI to identify adenomas. If pituitary imaging is inconclusive, inferior petrosal sinus sampling may be used to distinguish pituitary from ectopic ACTH secretion. For ACTH-independent cases, CT or MRI of the adrenal glands helps identify adrenal tumors. Management depends on the underlying cause. In Cushing disease, medical therapy such as cabergoline may be used to suppress ACTH production, especially in small pituitary adenomas or when surgery is not immediately indicated. The definitive treatment remains transsphenoidal pituitary surgery when appropriate. For ectopic ACTH-producing tumors, treatment focuses on locating and removing the source. In adrenal tumors, surgical removal of the affected adrenal gland is the preferred approach. When surgery is not possible or cortisol levels remain uncontrolled, medications that inhibit cortisol synthesis may be used as adjunct therapy.